For someone that's never been shot before, can you explain what that feels like?
And shit, that shit happens so fast, you don't feel it.
I'm a survivor, ain't gonna give up. Today we're talking about gunshot wounds and the pain associated with them. I have a firearm license and I have been to the range. So yes, I have shot a gun and I am aware of the damage that they can do. I have also treated patients who have been shot before. So I have seen firsthand that damage and had to work very, very hard to repair it surgically. But I have never been shot, at least not by a bullet, that is. So I don't know how that feels. However, many people have been shot and live to talk about it. So there are those who know exactly how it feels. Gun violence is an extremely prevalent issue, especially among American young people. According to the American Public Health Association, it is the leading cause of premature death, killing more than 38,000 people and injuring another 85,000 per year. Doctors such as trauma doc Sheldon Tepperman know the severity of this firsthand.
If you look at who me and my colleagues are taking care of here at Jacoby, it's young people. It's squarely in their 20s.
The US ranks #1 in the list of countries with the most privately owned guns, as pointed out in the 2018 edition of the Journal of Injury and Violence. At this point, there's basically more guns than people, and that number only accounts for the registered guns.
I think it's the access to guns. It's easier to get a gun now than it is a driver's license, and I think that's the problem.
And obviously, these guns, which are so readily available, are being used, aka being shot, because people are getting shot. To better understand the damage caused by gun violence and to get a sense of what being shot feels like, we will hear from those who've experienced it firsthand. Of course, pain is subjective, but there are commonalities amongst most testimonies. We will also look into the factors that play a part in gunshot wound severity and a person's chance of survival. Let's get into it. There are many things that determine the severity of a gunshot injury. As I said, pain, how you actually feel, varies from person to person.
What's the pain still?
It's still up there.
I just feel like this guy just needs to get on the morphine or something because he's just in so much pain.
As a doctor, I receive a lot of patients who come into my clinic who claim they are in excruciating pain. On a scale of 1 to 10, they would rank themselves 10. However, I often have to put things into perspective for these people so that we're both communicating with the same language. 10 is supposed to be the worst pain imaginable, aka you would pay me $1,000 right now to cut off the injured extremity with a rusty freaking butter knife. Gruesome, I know, but yes, that's a 10. After I say that, their answer usually lowers. All this is to say that pain is extremely subjective. The same injury on one person may feel like barely anything, while feeling like death on another.
Point to where the pain is.
Middle of my stomach, all the way to the left. Like 10, dude.
Worst pain ever.
For the sake of the video, we're going to assume that we all have a similar pain threshold and say the general rule is, the more extensive the damage, the higher the pain. We're going to cover everything from when the gun is fired, the bullet's pathway through the body, and finally touch on the long-term treatment of the wound. And because getting shot can be so traumatic, the pain doesn't always end when the physical wound is healed. The damage done by one seemingly isolated incident can spread throughout entire communities. But we're getting ahead of ourselves. Let's see where the pain starts. All right, so gun in hand. First off, the type of gun obviously matters because this will determine the type of bullet that will ultimately penetrate the skin and with how much force it penetrates. High caliber weapons and ammunition are designed for maximum tissue disruption, so they cause more extensive injuries and thus more pain. This would include rifles designed to fire rounds that are as big as even the .50 caliber. An AK-47 would typically cause more damage than a pistol because it fires larger, faster rounds and can shoot more rounds more quickly. Unless you have a switch, that is.
They make the .50 BMG look like a little brother who needs to be taken to school.
Faster the bullet and the bigger the bullet, the more force it has and the more energy it has. It creates like this cylinder mass
effect around it.
Therefore, the type of gun usually determines the mass and velocity of the projectile, which affects the kinetic energy it carries, as pointed out by Raynor in the book on gunshot wounds forensic pathology. The higher the amount of kinetic energy transferred to a person being shot, the greater tissue damage upon impact.
Oh, look at that. My. That's like 3 times bigger than the 9mm.
As explained by Gracie Baum in their article on gunshot wounds, ballistics, pathology, and treatment recommendations, the reason kinetic energy determines wounding potential and thus tissue impact is because it determines penetrating capacity. That is, how deeply it cuts through and how much tissue is pushed out of the way. The next factor that affects injury severity is the range the gun is being shot from, the distance of fire. Shesta and colleagues explain that distance determines effects of accompanying components, and therefore appearance of skin and tissue surrounding and inside the injury. Accompanying components are things like muzzle burns in contact wounds, flame burns and abrasion rim, which is a ring of torn tissue caused by the bullet's contact with the body in close range injuries, soiling or enveloping of surrounding skin by smoke and gas, and tattooing, embedding of unburnt particles and metal scraps in the surrounding skin in mid-range wounds, and gunpowder residue, burned or torn clothing, and possible bullet fragments in distant or far-range wounds. A grease collar where the heat and pressure from the gunshot cause the lubricant from the bullet or cartridge to be deposited around the entrance of the wound will be present in most wounds, except possibly far-range ones. You may be thinking, why is this important? The pain comes from the bullet penetration, duh. However, these things that accompany the bullet matter because when debris from the firearm is pushed into the body, there is an increased risk of infection. The primary damage from the bullet already comprises your body's ability to fight off infection. So the foreign materials introduced that can serve as a medium for bacteria to grow do not help. This is most likely in loose contact injuries, meaning when the gun is shot from close range but not directly touching the skin. In this case, the gases, gunpowder, flame, and other material mostly enter the wound.
Dodge this.
Next thing to consider is the direction the gun is being shot from, because this will determine if the injury is a through and through or not, obviously equally relative to the positioning of the person being shot. This means whether there is solely an entry wound and the bullet remains in the body, or if it also has an exit wound, because this will affect the characteristics of the injury.
I don't think we did. I don't think it made it all the way through, and that's really surprising. I wonder where that thing stopped at.
In the orthopedic research and review article I've been referencing, the authors explain that if the bullet exits, only a fraction of the kinetic energy is transferred to the body, decreasing the potential energy that can be converted to tissue damage. Meaning, through and throughs will likely cause less damage, though this depends on where it is and what it hits. The article continues by saying that exit wounds usually occur when projectiles are non-deforming, excessively powerful, fired at short range, or if the bullet hits a thin tissue. However, if the bullet is retained in the body, all of the remaining kinetic energy present at impact is transferred to the tissue. If the bullet remains in the body, it can either come to rest intact within the soft tissue or strike a bone or metal implant, causing fragmentation. This spreads the damage even further. In a BuzzFeed video, Trevor recounts his painful experience.
The bullet itself exploded in my leg, right next to my femoral artery. It felt like shards of glass were going all throughout my leg.
An important factor to mention is yaw.
Yeah!
Which refers to the rotation or tumbling of the bullet along its longitudinal axis after its firing. When propelled from the barrel, it initially travels in a stable, nose-forward orientation, but as it travels through the air, various factors can cause it to deviate from its stable path and start to yaw. In a Washington Post video, Director of Trauma and Acute Care Surgery at the George Washington Medical Faculty, Dr. Babak Sarani, gives the analogy of throwing a football. A perfectly spiraling football has no yaw.
When you see a little bit of a mistake when the quarterback throws the ball, and that ball has a little wobble, all of a sudden, that becomes a much less precise throw.
Just like it would increase the likelihood of a fumble, this increases the likelihood of damage to the body. The Orthopedic Research and Review article explains that most bullets come to rest within the body at 0 or 180 degrees, either directly forwards or backwards, resulting in tissue destruction no larger than the bullet's caliber. If bullet yaw is 90 degrees on contact, tissue damage can triple.
Up, down, left, right, not dead straight, but sideways. And so it's just going to start tearing you.
An external indicator of high yaw is the presence of an abrasion rim. So we've covered gun type, distance, and direction. Now on to the vital, and I do mean vital, aspect of location. This can be a defining factor in whether someone survives a gunshot or not.
From the trauma surgeon's perspective, bullets are all about real estate. Location, location, location.
Wounds in highly sensitive areas, such as the abdomen, chest, or head, are likely to cause more pain compared to wounds in less sensitive areas like the limbs. If the central nervous system is disrupted, that is to say the brain or spinal cord, it can cause immediate incapacitation or loss of function, depending on the extent of the damage. If the bullet hits major blood vessels or major organs, such as the heart or lungs, it can cause rapid hemorrhage and shock, leading to incapacitation or death. An excerpt from Gunshot Wounds Forensic Pathology explains that solid organs are more susceptible to significant injury compared to hollow organs or elastic tissue. This is because solid organs play important roles in the body, have denser tissue, and have a lot of blood flow. Unlike hollow organs, they don't have as much protection around them either. Furthermore, bones can be fractured when hit by bullets, which increases the severity of the issue. And as if that wasn't enough, bullets that hit bone typically shatter and spread out from the point of impact, leading to more tissue damage. As the infographics show channel explains.
Bullets that break apart within the body can rip through surrounding tissue and muscle. The more damage caused, the more pain signals will be sent to the brain.
This can be particularly problematic because
most major blood vessels travel next to bones. Nerves, arteries, veins travel next to bones.
On a somewhat side note, location of impact also affects the degree to which intervening layers of clothes or objects can help reduce both the bullet's velocity and the deposition of accompanying material. Of course, if you hit a vulnerable area, the bullet is likely to cause damage anyways, but you may be partially shielded by what you wear or how you accessorize. But I mean, sure, your cell phone case can protect your phone, but is it gonna stop a bullet?
No, no, no.
Either way, location is the main thing that determines what path a bullet will take through the body and how much damage it will do. To sum it up, we're hoping if you do get shot, the bullet avoids major organs, blood vessels, bones, and especially the central nervous system. Let's continue, however, with the bullet's path of destruction once it's actually in the body. We'll start with the general effects that occur from gunshot wounds, then go into more area-specific injuries. Baum and colleagues explain in their article that when a bullet enters the skin, it causes tissue to move outward, making the entry wound larger than the bullet itself. But the skin's elasticity allows the wound to shrink back. A similar kind of thing happens within the body as well. Common among all is a permanent cavity and a temporary cavity. As explained in an article designed for healthcare professionals written by Dr. Haley Willesee on patient.info, the permanent cavity or hole refers to the main track the bullet follows and the subsequent tissue damage. It crushes or tears anything in its way, similar to other forms of penetrating injury, and the size depends on the bullet size, deformation, and fragmentation. As explained by Dr. Serrani,
So the permanent cavity is simply the hole that the bullet is traversing through, the physical hole it's going to literally punch.
However, this isn't all that happens. The temporary cavity refers to the temporary swelling of tissue, which can tear or stretch organs. As Dr. Serrani explains, the energy imparted is what causes the tissues to expand and then recoils behind.
There's a wake that is created behind the boat, and that wake is the temporary cavity of a bullet.
As the hot gases fade and tissues settle back, a permanent cavity forms where the bullet traveled. If a bullet spins a lot, it can cause more swelling. The severity of this damage depends on factors such as the bullet's size, speed, and type, as well as the degree of tissue compression beyond its ability to stretch. While the forces causing the temporary cavity act for only a brief period, the results could last for a long, long time. Regardless, that's what happens when the bullet penetrates the skin, no matter where it penetrates. But the velocity of the bullet itself isn't the only thing that can cause swelling. The damage of small blood vessels and muscles from high-energy bullets can lead to further swelling and even clotting. See, blood vessels, muscles, and nerves are surrounded by connective tissue called fascia, which isn't elastic, so it doesn't stretch very much. The medical education channel Osmosis explains.
So when the pressure within these compartments rises, normal blood flow can be cut off, leading to tissue damage due to hypoxia and ischemia.
Hypoxia occurs when tissues in the body don't receive enough oxygen. Ischemia refers to reduced blood flow to tissues, resulting in oxygen deprivation and potential tissue damage. Therefore, compartment syndrome can occur, which refers to pressure buildup within a confined space, resulting in those previously mentioned effects. And again, this is a complication that can occur anywhere in the body.
I only have 12 bullets, so you're gonna have to share.
Let's count them down.
While the most common injuries are to muscles and other soft tissues, let's move on to site-specific injuries, mainly chest, abdominal, limbs, and head. As explained by Dr. Willesee, injuries to the chest can harm vital organs like the lungs, heart, and major blood vessels. Severe bleeding from vessels or the heart may require surgery if drainage into the chest cavity is excessive. One common injury is a hemopneumothorax, where blood and air fill the space around the lungs. This problem requires a chest tube to drain the trapped fluid and air. A tension pneumothorax, where air builds up and collapses the lung, also requires quick pressure relief with a chest tube or needle insertion or a needle decompression. Medical Education Channel 0 to Finals explains.
Chest drains are tubes that are put inside the pleural space to relieve fluid or air from the pleural cavity.
Another dangerous condition is cardiac tamponade, where fluid builds up around the heart. As we can see on this video from Alila Medical Media,
fluid accumulates abnormally in the pericardial sac. It compresses the heart, leading to decreased cardiac output and circulatory shock.
It's often difficult to diagnose, especially in a chaotic trauma scene, and the typical warning signs, Beck's triad, may not be present. This includes low blood pressure or hypotension, distended neck veins, and distant or muffled heart sounds. To relieve the pressure around the heart, a needle can be inserted near the bottom of the sternum bone, pericardiocentesis.
The standard approach for pericardiocentesis is subxiphoid, aiming the needle toward the patient's left shoulder.
Dr. Willesee goes on to explain that abdominal injuries are also tricky because they may have hidden bleeding or bowel perforation, and therefore often require immediate surgery to avoid further internal damage, hemorrhage, or infection. Limb injuries aren't typically as severe. They usually involve nerves, tendons, and blood vessels, and can usually be treated without surgery, but not always.
I just f***ing shot myself.
Especially if the bullet impacts a bone. Then the potential for severe injury or even limb-threatening injury is significantly elevated. On the other end of the spectrum, gunshot wounds to the head are pretty intense. According to the American Association for Neurological Surgeons, they are 90% fatal. Most die before even arriving at the hospital, and for those who do make it, 50% die in the emergency room. If it doesn't hit vital brain tissue or blood vessels, a person's chances of survival are greater than basically zero.
When there's more kinetic energy, there's just overall more damage. A stronger pressure wave through the skull, more external gases going into the head, more secondary fracturing, and even splitting of the skull itself.
Nevertheless, no matter where someone is hit, they almost always require some sort of immediate professional medical attention. First aid needs to be performed ASAP, even before emergency responders arrive. Bleeding is the leading cause of death in gunshot wounds, so this needs to be managed by applying direct pressure to the wound or by gaining proximal control of bleeding by way of a tourniquet, or tourniquet, depending on where you come from. But it's the same thing I want me to talk about.
The first 10 minutes of the injury are called platinum.
Platinum time is of vital importance, like literally. The faster they can get to the hospital, the better their chances of survival are. In an Edivar documentary on gun violence, the chair of surgery at Temple University Hospital, Dr. Amy Goldberg, gives us a glimpse of what goes on behind the scenes in the emergency room.
In the moment, it's all about taking care of the patient, and the focus needs to be intense, and you can't be distracted by anything.
Whatever walks into the door, we're all gonna band together, and we're all gonna get it done.
Trauma units at the hospitals are there to handle business. Dr. Goldberg goes on to stress the importance of staying unbiased in the operating room. Everyone deserves life, and it is a doctor's responsibility to aid with that.
Every patient that hits the trauma bay has somebody that loves them. I never pass judgment. I never want to know anything about the circumstances of the shooting.
Now, for both surgical and non-surgical patients, bullet removal is recommended. However, if surgery is needed, removal is generally not the main priority of the surgeons. Dr. Goldberg explains, it's a game of catch-up in the emergency room.
Fix all the damage that the bullets do. It's not necessarily looking for the bullets and removing them.
Sometimes the bullet is even left in the body if extracting it would seem to cause more harm. Generally, surgeons want to move around your insides as little as possible. That said, there are a few considerations.
They said you have about 45 holes in you. I said 45 holes.
Because surgery can sometimes raise infection risk, harm blood supply, and further damage tissue with little added benefit, it's only performed when absolutely necessary, which is usually with high-energy gunshot wounds. In the BuzzFeed video, Drea, who was shot in the face, needed surgery.
My chin was shattered, my mandible was broken, so they had to remove the debris, the teeth, the bone. They put a plate in my jaw.
Furthermore, complex wounds require a team led by a trauma surgeon. That might be either a general surgeon or an orthopedic surgeon. Often, treating someone who's been shot can be a lengthy process involving multiple surgical sessions. Dr. Joseph Sarkar, Director of Emergency General Surgery at Johns Hopkins Hospital, recounts a particularly difficult case.
Who was shot over 13 times, injuries in almost every cavity in his body. He went to the operating room over 15 times.
Obviously, this can drag out the pain. There can also be secondary complications, either while still in the thick of it, that is to say infection, bleeding, or internal organ damage, or afterwards, infection, delayed healing, nerve damage, scar tissue formation, chronic pain, or functional limitations. If there is spinal cord damage, a person can become paralyzed as well.
I didn't think I was gonna walk again. I got a bullet that's in the middle of my spine that's lodged, and I got one that's on the side of my spine touching. The hospital was basically saying like, damn, like, I don't know how you're not paralyzed. Me either.
The body's inflammatory response to the injury can cause swelling, which may compress nerves and increase pain. That is to say, even when a patient finally gets discharged from the hospital, recovery can be difficult.
80% of our gunshot victims live, but it's kind of what are they living with and how are they living.
Reconstructive surgery. I had stitches all the way up and down my right leg. I couldn't actually walk for at least 6 months.
A person may require physical therapy to return to their normal activity, and depending on how severe the injury, this can take weeks, months, or even years. Victoria Wiley, who leads a support group for paralyzed gunshot survivors, sheds light on what it's like for those with more permanent damage.
So getting shot was easy. Now trying to find housing, employment, basic things like driving your car is a challenge.
Even after the physical body heals, the trauma may last. Many people who have been shot suffer from PTSD, which can exacerbate the perception of pain further. Obviously, many war vets experience this, and paired with the machine-like training which promotes emotional suppression, it can be very difficult to deal with. However, I feel like we could make an entire video on the damage of warfare, and for this video, I want to focus more on general gun violence. No matter who you are, getting shot is traumatic, and psychological pain can affect all areas of someone's life.
I still struggle with it today, actually. Crowds, they're a huge trigger. I get anxiety, panic attacks. I constantly am scanning the room that I'm in.
Even though Michael dodged 17 bullets, he is wounded deep inside.
It can have a ripple effect on their social relationships, work life, and finances. And traumatic events don't just affect the individual, they can affect family, friends, and society at large. As I said, gun violence is most prevalent amongst American youth, especially African American youth in their 20s.
The leading cause of death in our African American community for our young males between the ages of 14 and 25 is gun violence.
Many families have to deal with the loss of their relatives, particularly parents with children.
Every year I see candles from kids being killed, and it hurts. Unfortunately, this time this is my kid. No parent deserves to bury their child.
Having to do that is the most difficult part as a doctor.
What will make me leave trauma surgery, it'll be that I just can't tell another family member that their loved one has died.
Even if the child survives, if they are now struggling with mental health issues, it will likely affect those close to them as well. Overall, gun violence damage extends beyond the body and beyond the individual. Scott Charles, who is the trauma outreach coordinator at Temple Hospital, explains.
This issue of gun violence isn't really as much about living it or dying as much as it is about suffering.
And of course, gun violence can affect innocent people. Many who are involved in altercations catch stray bullets. Occasionally, shooters fire at random.
I was stopped at a red light. All of a sudden, shots rang off. My rear window shatters, and that's when I ended up getting shot.
Much of the gun violence is gang related, either directly or indirectly through the promotion of gang culture. To counteract the glamorization of guns, Charles set up a program called Cradle the Grave in his hometown, in which young people are invited into the local hospital in order to get a better sense of the actual damage guns can cause.
After seeing the realities of pulling the trigger, they see violence as a less reasonable reaction to being disrespected.
Many of the young people who are involved are caught up in a retaliation cycle of tit for tat. Either they themselves or someone they know gets shot, or even just disrespected, and then they seek revenge. In a sense, it's like a contagious disease. Mervyn Moore explains how.
When somebody gets infected with it, it doesn't stay with them, they pass it along, right?
It spreads from the perpetrator to the victim, and then the victim becomes the perpetrator.
The pain gun violence causes can spread throughout the society, leading to fear, paranoia, and in turn, even more pain. Collectively, this cycle can seem very difficult to free ourselves from. And this video isn't about gun laws, especially American ones, but I do believe that it's important that everyone who owns a firearm understands the responsibility they hold and the ripple effect that one senseless act of violence can have on an entire community. And remember, this is a registered gun owner talking to you.
Just like lung cancer is preventable, dying in a car accident is preventable, hypertension, high blood pressure is preventable. It's preventable.
Thankfully, there are advocates like Moore, people from the neighborhoods that can relate with the young people who are setting good examples, visiting the hospitals, and talking to those who may be thinking of retaliation. And according to Dr. Joe Romo, who's involved in the Jacoby Stand Up to Violence program, their intervention method is pretty effective.
Those patients that we also intervened in had a 60% less likelihood of coming back with a re-injury compared to those patients that we did not see.
As with many societal issues, spreading awareness helps. Now, we've looked at gunshot wounds from a medical perspective. Objectively, what happened? We know the factors that contribute to potential pain and how far-reaching and long-lasting they can be. But let's hear from those who've actually been shot. As I said, pain is subjective, so what did it actually feel like? The next account is from rapper Slim 400, who has unfortunately since passed away from a shooting in late 2021. I thought it was valuable to include because though his description is quite lighthearted, it seems to echo the thoughts of many gunshot survivors.
You don't even think you shot. You ain't really feeling it. It's gonna be that little moment. So your body start getting hot, and then you start looking like, damn, what the fuck is that?
Surprisingly, many people report not feeling it at first. They may feel something, but wow, I must have just gotten shot, is usually not their initial reaction. Obviously, whether they notice or not is largely dependent on if the person is in an active combat situation or if they just happen to be caught by a stray bullet.
I didn't know what was happening. All I know is they shooting. I didn't know I was getting hit.
Guns are loud though, so it's unlikely a person could be completely oblivious to it, even if they just were minding their own business. Nevertheless, even many of those who are aware they got shot say it doesn't feel necessarily terrible the moment of impact.
I felt impact when the bullet actually entered, but it was more shocking than anything.
One gunshot survivor remembers the impact of the bullet feeling like someone had thrown a small pebble at her.
Of course, the pain felt depends on all circumstantial factors we've already discussed. But most importantly, what within the body the bullet penetrates. That's why it's so difficult to generalize a gunshot. Some report the initial impact feeling just like that, an impact. Now, you'd think that someone in the military would likely experience higher levels of pain than someone involved in neighborhood shooting, simply because of the weaponry involved.
He remembers it feeling like being hit by a sledgehammer in the stomach over and over, resulting in the worst incontinence possible.
We'd expect a reaction like this from an assault rifle. That said, we have to keep in mind that soldiers also train to withstand higher levels of discomfort than the average civilian. So while they may technically experience objectively more pain, they may feel subjectively less. As a generalization for your average gunshot, rapper Jay Cinco's got a pretty good description of it.
It actually feels like what you think it would feel like if you got shot by a pellet gun. A metal ball just like going inside your skin, like just piercing through.
However, I was quite shocked to hear from so many that it barely hurt initially, but it kind of makes sense. The reason why some may initially feel nothing is likely because the brain hasn't realized what's going on yet. As soon as it does though, possibly from seeing the blood, the body goes into survival mode. The reason then why pain still may not register even after realizing is because of this.
Brain dumps adrenaline into the bloodstream, which causes the body to increase blood pressure and heart rate, expand air passages to the lungs, and maximize energy output.
However, the body can't keep up that heightened state indefinitely, but it can do it for long enough to survive a life-threatening circumstance. The pain generally intensifies once the trauma has a chance to set in.
Sharp, burning pain right on the bottom of my face, and it just felt like it was on fire.
If you would have never thought about it, you probably could have kept bragging. Could have kept running or doing whatever you was doing. The moment you think about it, that's when your mind kind of loses it.
And again, this physical realization of pain can happen anywhere from immediately to after you fled the scene. The initial shock is worn off and you're trying to catch your breath. At that point, many report heat spreading throughout the body, radiating outward from the point of impact.
It was like this intense heat, like somebody put you in a pot and just started boiling you. It was just, after that, I just lost consciousness.
Another obvious reason why some people may not remember a high degree of pain is that some lose consciousness almost immediately, usually from shock, with their first memory of the incident being woken up in the hospital. If a patient is unconscious and unable to protect their airway, a doctor will have to intubate or put in a breathing tube, sometimes with no prior anesthetic.
I actually woke up at the surgery table when they were inserting a chest tube. That is like the most pain I've ever felt in my life.
That must have been scary, to go from shock to passing out to waking up while doctors shove a tube down your throat. While going in and out of consciousness, the brain would likely be struggling to process reality. Another interesting thing people mention that also has to do with how traumatic events can alter your state of consciousness is the out-of-body experience. Rapper 21 Savage explains his experience with this.
It's a third-person feeling. My soul came out my body and I was watching myself get hit. You get what I'm saying?
I was not in my body when I was shot. You feel what I'm saying? It's like an out-of-body experience. That's the first thing I'm gonna tell a person. It's an out-of-body experience.
It was a very kind of surreal experience because I felt like I was watching myself as everything took place.
That last clip was the voice of Dr. Joseph Sarkar, who we already featured, who was actually shot himself. In the doc, he said that his experience inspired him to become a doctor, to pay it forward. So that one incident became the catalyst for what would be his lifelong career, which just shows how impactful it was. And I know we hear about gun violence, but for many it's like that couldn't possibly happen to me, man. Which is why it's so shocking when it does. It's almost as if your consciousness takes a step back and says, I'm sorry, what's going on? Are you sure?
Nah, it wasn't painful. It was just more so just probably scary. It was more of an inconvenience.
It seems like in a near-death experience and intense shock and trauma, your consciousness lifts away from the physical body that feels under attack or vulnerable to a place of safety in order to get a better understanding of what's going on.
you so focused on trying to pop back, or you so focused on trying to survive, you're not feeling these gunshots hitting you. Because in your mind, you so busy thinking about surviving.
It's having difficulty making sense of it because at that moment, the violence seems so senseless.
Basically, like I said, I'm dead. So I'm going through that tunnel, and if I'm about to make it home or I'm about to survive. I seen homies from back in the day.
This kind of reminds me of what we already discussed the body doing during life-threatening situations. The brain goes into survival mode and releases adrenaline, giving you almost superhuman powers. You get access to more of you. However, people handle these life-changing events. It seems as though many are able to tap into hidden resources they didn't know they had in order to get through it. Those in the military, particularly in special force units such as the Navy SEALs or JTF-2, are familiar with this. They know, even though you may feel like you have nothing left in you, you actually have reserves of energy that you can pull from in times of need. Known as the 40% rule, it states that when you think you are done, you are actually only 40% done, with another 60% in reserve to keep you moving. Along this line, we as people are capable of much more than we believe and have the inner strength to overcome intense pain and survive something like a gunshot. And thankfully, many do.
And you were only 17 years old at the time.
Yes.
You got shot 35 times.
Yes.
I mean, I know of people that have gotten shot one time and they didn't make it. Sometimes not even in a vital organ. You got shot 35 times and survived. I've never even heard of this. I mean, do you ever just sit back and think like 35 times and I'm walking around talking?
Hell yeah.
My life.
This capacity to survive is inherent in human nature. Coping in times of stress is something we're good at. But life can already be difficult enough, so we don't need to make it harder for ourselves by adding extra stress to it.
I think all the time, like, I'm a testimony, like, can't be touched, like, I survive all that, so like.
That said, when people are affected by trauma, either physical or mental, they all experience it differently, and consequently, their experiences of pain may vary. I'm sure we can all agree, however, that gun violence has disastrous effects that reach far beyond the individual. People can too easily get caught up in the cycle of gun violence and find it difficult to free themselves from it. But it is largely preventable, and again, while this video is not about gun laws, in addressing the problem, we have to address gun accessibility and regulations. It was brought to my attention in the Endeavor documentary that there was a bit of back and forth in 2018 between the doctors and the NRA. The NRA basically said,
doctors have no business being part of the solution of firearm-related injury and death in America, that we should stay in our lane.
To which doctors, who have to deal with the aftermath of someone's act of aggression, responded firmly, "This is my lane, bro." Not to mention the economic impact this has.
There are some estimates that look at the total economic burden to be over $220 billion.
Money that could be better spent on, say, the American healthcare industry that people so often complain about. Regardless of what you think about gun accessibility, I think the focus needs to be on education rather than restriction. Education is important both in gun safety, but also just in healthy living strategies and emotional intelligence, so we can learn to be more proactive instead of reactive.
Ever since then, you gotta be aware. Turn your radio down. Stop watching movies. Stop watching that ass. Be alert.
It's also important that young people feel empowered and supported within their communities so they feel like they can truly pursue the things they enjoy without getting sidetracked by unnecessary conflict. If you're building a life of love, then risking it to shoot someone over whatever seems less and less worth it. All that to say is that being shot hurts everyone, even the shooter. If you enjoyed the video, be sure to subscribe and give it a big thumbs up to feed the algorithm. And if you are already subscribed, make sure that YouTube didn't unsubscribe you from the channel, cause yo, they do that, bro. We are working towards 700,000 subs and we would love to have you with us on that journey. If you didn't like the video, be sure to let us know why in the comment section down below. I read as many comments as I can and we use your feedback to make our videos better for you. And of course, don't forget to follow my gym Human 2.0 Fitness for free right here on YouTube, where we post content that helps you move better and prevent injury. And if you simply want to support the channel, then consider becoming a member, an official member of the Intern Army. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one. Pew!